Hello, I'm going to be presenting on Prader-Willi syndrome. I'm going to give a quick introduction to the syndrome as well as go over symptoms, diagnosis, impact on individuals, industry, and society, and then go over the treatment as well. So what is Prader-Willi syndrome? Prader-Willi syndrome, just to give you a little background, was first recognized in 1956 by Swiss doctors Andrea Prader, Alexis Labert, and Heinrich Willi. It's a rare, non-hereditary genetic disorder that impacts both males and females equally among all races and ethnicities, and it's the most common genetic cause of life-threatening childhood obesity, and it occurs in 1 out of every 15,000 births. Symptoms of Prader-Willi syndrome include small hands and feet, abnormal growth and body composition, hypotonia or weak muscles at birth, insatiable hunger, which leads to extreme obesity, intellectual disability, speech apraxia and dyspraxia, as well as smaller issues such as scoliosis, dental issues, sleep disorders, and skin picking. And to the right, there's an example of what someone with Prader-Willi syndrome might look like. So in terms of the science behind the disease, Prader-Willi syndrome is caused by an abnormality of chromosome 15. The most common cause of Prader-Willi, which occurs in 70% of cases, is the absence of paternal genes on chromosome 15. The second most common cause, which impacts 30% of cases, is that there are 2 copies of chromosome 15 inherited from the mother. And the most rare cause of Prader-Willi that impacts 1 to 3% of cases is that there's a defect in the paternal genes on chromosome 15. To the right, above, there are visual examples of the 3 causes of the disease. Symptoms are also believed to be caused by dysfunction of the hypothalamus as well. However, researchers have yet to determine how the abnormality of chromosome 15 causes the hypothalamic dysfunction. So in terms of the diagnosis, Prader-Willi syndrome is diagnosed using a blood test referred to as methylation analysis. This test determines whether or not the patient has any type of genetic abnormality in the PWS critical region, and it detects over 90% of cases. To then determine the specific cause of the genetic abnormality, there is a FISH or fluorescence in situ hybridization test, which only identifies PWS that's caused by deletion. Additionally, there's a chromosomal microarray or CMA testing, which is becoming the test of choice in detecting chromosome deletions. CMA testing can also detect cases of uniparental disomy or UPD, and UPD can also be detected by using imprinting defect testing, which requires blood from both the patient as well as the parents. So this is just a diagram showing how doctors go through diagnosing that someone does have Prader-Willi syndrome, and then how they go through diagnosing the specific cause of the symptom. In terms of the impact on individuals, Prader-Willi syndrome causes a great amount of distrust and stress amongst family members due to the fact that many patients are unable to live on their own because of their insatiable hunger. So this puts responsibility on the family to regulate the patient's eating habits to ensure that they don't reach a dangerous, life-threatening weight. Many patients also struggle with muscle weakness, which causes relatively easy tasks, such as getting up off the floor, to be extremely difficult. The effect on the industry, seeing as Prader-Willi syndrome is extremely rare, a lot of doctors are unaware of the span of symptoms and the side effects that are involved. In the image to the left, you can see from a documentary, this doctor offered a girl with Prader-Willi syndrome candies at the doctor's office, and she was offended, as you can tell by her face, from her parents not allowing her to eat multiple candies. So she just thought her family was being very strict with her diet, seeing as she was already overweight, making her feel bad about it, but really it is a symptom of Prader-Willi syndrome that she would just continuously eat candies if she was allowed to. In terms of the effect on society, an estimated 160 million Americans are either obese or overweight. Of this, roughly 2/3 of adults are obese or overweight, and 30% of children are obese or overweight. So society might view people with Prader-Willi syndrome, not knowing that they actually have the disease, as simply overweight and being overweight by choice, eating unhealthily. They don't understand that it's an actual genetic disorder and that it's something that they have no control over. They also might confuse their intellectual disabilities and speech apraxia and dyspraxia as a type of autism when in reality it is a symptom of Prader-Willi syndrome. In terms of the treatment, there currently is no cure for Prader-Willi syndrome. However, there are treatments for specific symptoms that are associated with the disorder. The human growth hormone has shown to be extremely effective for patients with Prader-Willi, as it increases patients' height, decreases body fat, increases muscle mass, improves weight distribution, increases stamina, and increases bone muscle density. However, there still is no treatment for the inability to control food intake, so this does prevent many patients from being able to live independently, as they need to have constant environmental control and supervision. So this is a diagram or chart showing treatments for smaller symptoms of Prader-Willi, such as scoliosis, which can be treated by orthopedic physicians that are familiar with PWS, and psychiatric and behavioral issues can be treated by a combination of behavioral therapies, environmental control, and medication, and consulting a mental health professional that's familiar with PWS. Thank you for listening to my presentation, and I hope this helped you get a better understanding of Prader-Willi syndrome.